3 years ago, an educator, a nurse, a physician, a pharmacist, a rabbi, and a social worker walked into a bar. It's not the beginning of a joke. It really happened. We had just completed the first Interprofessional Forum on Ethics and Religion in Healthcare. And we desperately needed, a debriefing. So we found a local establishment right around the corner that had a quiet room with tables and stools, chairs. And we sat there and immediately agreed it was a successful program. But more importantly, we recognized that it was a terrific model for facilitating and advancing interprofessional education and practice.
Of course, the considerations around organ transplantation are enormously complex. And I'm in no way suggesting that the risk-benefit analysis, which I'm sure you'll talk about today, should always or even usually be weighted toward the benefit. There has to be a weighing. I just thought you should be reminded that what you're doing matters, and your discussions today matter. That what you're talking about today matters to the hundreds of people you'll meet and care for, and to the many thousands more who you will never meet.
Recipient selection is clearly an ethical dilemma that we deal with all the time, but even today we struggle with these decisions. Do we put smokers on the waiting list? How compliant are the patients? How faithfully do they have to take their medicines and their treatments before? How about their social worth? Children, we always feel a big heart towards. We think that they have a huge future ahead of them. How about criminals? Should we transplant them? People in prison? Other questions would be, do we always transplant the sickest patient first? That's what the MELD score is doing. Does that result in necessarily better outcomes? Do people live longer? Or is it better to transplant someone who's a little bit healthier and has an easier recovery? Does age matter? Is there an age cutoff? Like, for example, in Great Britain, if you're above a certain age, you don't get a kidney transplant anymore because you're considered to have lived your life. And what is a kidney going to benefit you when you're 83 years old? So I think there's lots of questions that we have to ask in order to make decisions, and I think sometimes there's not really a right answer.
I want to share with you an excerpt from a letter that we received from a grateful recipient. There are not words adequate to convey the magnitude of my gratitude. I simply do not know how to put it down on a piece of paper. But please know that with every breath I take, I will honor the gift that you have given me, the tomorrows that you do not have, that you have so kindly given me. And this is one of the privileges in our organization. Every day we receive letters like this from grateful recipients. Likewise, many donor families write to their recipients, and we're happy to share those.
Why the entire discussion of organ donation is incredibly complex within Judaism, because we have these competing values. The obligation to donate really depends on the level of risk involved for the donor. So let me just share with you two ideas. If the danger to the donor is much less than the danger to the recipient, meaning that the danger to the donor is much less than the danger to the recipient if he or she does not receive the organ, then the donor is permitted to donate, but not required. But if the risk to the donor is minimal, then there would be an obligation to donate. So I think maybe the best example of this would be bone marrow. So for example, if I am a marrow match to someone else, where the risk to the donor is really minimal, if I am a match for someone, Jewish law would say I have an obligation to go ahead and donate that marrow to another individual. So here we have another interesting idea, and actually this takes us back a little bit to something we had discussed in our first seminar, in our first conference, where we spoke about end-of-life issues. There's a concept, in Judaism, as I'm sure again in other religions, we believe that the body is sacred. The body is a receptacle ultimately for the soul. And even once the soul has left the body, which is what we believe death is the departure of the soul from the body still retains its sanctity. That's how we have a prohibition of what we call nivul hames, desecrating the dead. So again, you see the tension. On one hand, the body is sacred, and one of the ways in which we express the sacredness of the body is by keeping it intact, not touching it, not doing anything. There are even limitations as to who handles the body after a person passes, the sanctity of the body. On the other hand, if when a person dies, they actively have the ability to go ahead and preserve, or I should say give life to another, it would seem that that would trump any other consideration.